I'm going to show you a way to examine for the potential for the vastus medialis muscle to contribute to or be the cause of medial joint line pain, and also how to do a trial treatment to see if you can change the presence or the awareness of that medial joint line pain with this technique. I'd like to show you a problem that I think is quite common and yet misinterpreted, and that's pain in the medial joint line of the knee. So when we see this in patients, we typically think this could be a medial meniscus tear or an injury in some way to the medial meniscus, or even sometimes we think it's a medial collateral ligament issue. However, we know that it's possible that in some individuals this may in fact be an active trigger point in the vastus medialis muscle right here. And there's two heads. There's a long head and an oblique head. So it could be coming from either of those two heads, and all you have to do is deeply palpate in the area of the vastus medialis and then examine the same on the opposite side to see if there's a difference in terms of tenderness. When this is contributing to or literally causing the medial joint line pain, this will feel very different on the involved side as compared to palpating on the uninvolved side. So this gives you a way of considering that this may be a source of where this pain is coming from. One easy way to determine if that's a source of pain, once you've done this assessment, is simply to have the person put their leg down. And I'll show you as if this were the leg because it's closer to the camera for you to see. So again, we're going to assume now that it would be this leg that's having the tenderness over the vastus medialis. All you need to do is just to hook the superior aspect of the patella with your thumb and then just very lightly tap on the superior aspect of the patella through your thumb. Ask the person to lightly tighten up the quadriceps, just lightly, just a few times doing this. Then you can come back and reassess again, just to show you, even though I was demonstrating the technique over here, you can come back and do your reassessment here over the vastus medialis. And if that was a culprit contributing to the medial joint line pain, not only will this be less tender, but when the person gets up and tries to use their leg, they will notice that there's immediate improvement in the pain.